My name is Dr. Andrea Cole. I'm an anti-aging specialist. I've been using thermography in my practice for about a year now, and it's given me a wonderful tool to begin to evaluate patients, not only where they begin with me, but we can now document improvement in things that we're actually doing.
Actually, we've been trying to do
Thermography is very visual. If there is an area of the body that's inflamed or infected, it's going to appear on the thermogram as hot, as red. On the other hand, as we improve an area and we decrease inflammation, you're going to be able to visually see that area cool down. It'll be bluer, it'll be greener. So if there's any kind of intervention done, be it biochemical or energetic, you are going to be able to document improvement in those tissues using thermography.
Hi, my name is Amy Elliott and I'm the clinic administrator for this practice. This is my dog Mo. I'm quite familiar with thermography since we use it in our practice here. I've had thermograms, my husband, and now my dog's had it. And you could see where there was a lot of inflammation, partially on his leg, but mostly on his spine. It appeared that he had some sort of disc issue.
Hey Mo, you're getting a new collar.
We put a PhD on him after his first thermogram, and we did another thermogram. You could see after the PhD that there was definitely an improvement from his previous thermogram.
Hi, my name is Linda Hayes. I'm a certified clinical thermographer. I've been doing this for over 25 years. I use it in the medical field, the medical arena, but I have done racehorses, I've done golden eagles, I've done whales. With the animals, we're measuring the heat spots, and we're seeing how those heat spots can change with whatever we're using to help that animal. And I was very impressed with this test. Okay, Mo, smile. This is a greyhound. His name's Mo, and he was brought to me because he's been having left leg issues. And how you look at thermography is you look at the red's the hottest and the blue is the coldest, and this is the ambient room temperature. So we're seeing inflammation under the dog, and we're seeing it a little bit in the right leg. Now he is limping on the left leg, so let's look at the difference. Here's the left leg, and we're seeing there's a lot more inflammation in the upper part of the left leg. Now we want to see with thermography what's causing that. And here we're seeing a real temperature difference in this dog, which looks like a vertebrae in his upper back, which would cause him limping on the left side. And here's Mo again, 20 minutes later after we applied the PhD. And here you're seeing less inflammation, but especially on his leg that was bothering him, which he came in limping. You can see that inflammation has really settled down in that leg. And here we have the upper back again, and you can see how much that inflammation is dissipated in that upper spine. And that was only after 20-30 minutes time I took this picture from the first picture. So that was pretty amazing to me. I know he's a happier dog too. And this is another dog that was brought in today, and her name is Harley. And when I first took the pictures, we're seeing a lot of stress in this little dog. And here's an anterior, quite a bit of heat in the face and in the mouth, and we're seeing heat up there on the left side of the mouth. And here we're seeing Harley about 30 minutes after putting the PhD tag on this dog, and you're seeing there's quite a bit of difference in the heat and the stress in this dog. And here's a frontal view, and you see the heat in the mouth even has dissipated a lot in this dog. I was impressed with that, because we know periodontal issues are really huge in animals, and that's what causes diseases. And that's why it's wonderful to see a product that really can help the animal to be healthier, out of pain, take away stress, reduce inflammation. And that's what you're seeing in both these dogs, is you're seeing the inflammation reduced from these tags. Thermal imaging is a wonderful technology that we can use to see how this product interacts with these dogs' physiology. And we can absolutely see an incredible improvement in both dogs.
This is the perfect solution for Mo. He's done fantastic with it. I don't have to fight to give him pills. I'm not harming his liver by giving him aspirin or any other type of medication. I put a collar on him 3 months ago, and he's a very, very happy dog.